My name is Dr. John McAtee. I'm a pulmonary and critical care specialist, and we treat all sorts of pulmonary diseases and also symptoms. One of the symptoms that we treat often is cough, and a cough can be caused by many different disease processes. Today we'd like to talk about the cough that's created by a postnasal drip cough, and that is often associated with some anatomical problems as well. A simple cough can be caused by any kind of postnasal drip, but often patients have what we call the perfect anatomical storm, a deviated nasal septum and a large veil palate. In treating that cough from those anatomical problems plus the environmental issues, we have designed a program called the B.A.N.A nasal package, which is consistent of 4 items used in the treatment for this disease process. The 4 components of the B.A.N.A nasal package is and are blowing one's nose very well and getting all the mucus out of the nasal passages, and then using sequentially Afrin or neosynephrine spray, and then nasal steroid sprays, and then specific antihistamine tablets that are used in sequence that are either prescription or over-the-counter. These 4 components are designed to give one perfect relief in a matter of days, but they must be used correctly. Application of the B.A.N.A nasal package is dependent on doing these 4 things exactly right in the sequence that we will propose, and we will be showing you that with a patient in the next session. The patient will seat herself on the bed in a proper position such that every time she lies back to use the spray, she will land on the other side of the bed. First thing our patient will do is grab some tissue and blow her nose very well. This is not a fairy blow. This is a good Schwarzenegger blow so that you get that nasal mucosa dry. It's very important that you blow your nose. After she blows her nose very well, she will then use the first spray, the Afrin spray, and she will use this spray to be instilled directly into her nose. She'll shake up the spray, and then after blowing her nose very well, she'll spray 1 squirt to each nostril as she sniffs in. It's important to be sniffing in as you squirt the nasal spray Afrin into each nostril. Now that she's sprayed the nasal spray into each nostril, she will then lie back flat on her back with her head hanging off the other side of her bed, and she must be comfortable. That's very important. So you may have to shimmy around a little bit, but once you have blown your nose very well and sprayed 1 squirt in each nostril with the Afrin spray, then you lay back, and you will lay back for 2.5 minutes in a comfortable position. So if we go by the spray rules, the first thing that the patient will do is blow her nose. That's always precedes any spray action. So she'll blow her nose very well. Then she'll take the nasal steroid spray that she just primed and will spray 1 squirt in each nostril and then lay back just as she's done before. When she sprays, she'll be sniffing in as she sprays into her nose. Then she'll lay back flat on her back with her head on the shoulders on the other side of the bed with her head laying back in comfort. She will lay there for another 2.5 minutes. You are now ready to use the 2 pill forms of the B.A.N.A nasal package. The first pill one will use is the methylscopolamine tablet, and she will take 1 methylscopolamine tablet in the morning and 1 at night. That is a prescription drug, and you'll take 1 in the morning, 1 at night, and it will say on the bottle it is to be taken like that. It's important to realize in regards to the methylscopolamine tablet, it must not be taken if you have glaucoma or if you have a large prostate. After she takes the methylscopolamine tablet, then she'll take the next tablet, the chlorpheniramine tablet. Completed now how one does this sequence in the morning and at night for the B.A.N.A nasal package. The variation is done, and one uses this for 3 to 5 to 7 to 10 days. Twice a day for the first 3 days we use the Afrin, but the other components of the B.A.N.A package, blowing, the nasal steroids, and the antihistamines, continue for 3 to 5 to 7 to 10 days. The only thing that drops out is the Afrin spray in the morning after 3 first days where it's used twice a day. The 4th, 5th, and 6th days, one does not use the Afrin in the morning, but you do use it at night at the option of the patient.